I think today has been a very exciting and very helpful day to it's about 3,000 delegates that have been here. I've been looking at health and efficiency through technology and chaired all of the sessions that we've had throughout the day. And we've heard the scale of the digital challenge, the resources that are now available to help move that forward, the way in which both NHS Digital and NHS England are working much more effectively together to help ensure that we move to a paperless 2020 at pace. But that comes with huge challenges, and we had a fascinating session from Dr. Bob Wachter, who 2 weeks ago launched his report in looking at how we can move the acute hospitals in particular to having electronic patient records that work, the importance of having valuing chief clinical information officers, how we can build up that workforce, because this won't work. We won't move to a fully digital NHS unless it's clinically led. So how do we get the involvement of healthcare staff across the piece? So that's not just the clinical leads, but nursing staff, auxiliary staff and others. The second big challenge is how we harness what we've seen in the past 5 years for us as patients and members of the public. Our experience of information technology has been transformed. So what we can do at home, whether that's watching Netflix or booking tickets with our Wi-Fi at home, is better than in most of our workplaces, and particularly better than in the NHS and in social care. So there's now a real demand and a push from patients and the public to have that ease of access that we experience in many other parts of our lives happen within healthcare. So what does that mean? It means that we expect hospitals to know who we are, to be able to access our records digitally rather than the huge files that you see currently being carried around hospitals or sitting behind the receptionist at your GP clinic. The move to achieve that is going to take all of the effort of the exhibitors here. We do have technological answers, but how do we change the culture which ensures it's embraced by all staff? How does that mean that we change clinical practice? And how do we do that ensuring trustworthiness from patients and the public? So that sets a whole range of other questions about cybersecurity, about ensuring that people know that their digital health records, which are so valuable to people and they approach in a different way to many of their other records that are held online now. How do we ensure that we're a trustworthy place, that people know that their digital records are only going to be seen by those who should see them, but that when they are seen, they're accurate, they're up to date, and they guarantee the best possible care that that person can rightfully expect from the NHS.